Hello everyone and welcome back to my channel. Have you ever wondered about the ongoing discussions in medical research regarding the safety and efficacy of substances that can profoundly affect the mind states and that have been historically controversial? Today we are diving into the fascinating world of consciousness-altering substances and the evolving scientific understanding behind them. Also, we are going to address a hotspot theme on this episode. A hotspot episode is going to include a topic that is having rising interest by the scientific community and that is of course backed up by some concrete data. Any ideas? Today we are addressing the medical knowledge on psychedelics through 7 key Q&A updates. So, where's the current knowledge on the medical use of psychedelics? Before we answer this question, let's define these substances, take a brief look at their history, and explore the most common medical conditions for which they are being researched. As some of you might know, psychedelics are a class of psychoactive substances that can alter mood, perception, and cognitive processes. From a psychological standpoint, it can reveal what is unconscious to us, such as repressed memories and past traumas, and bring them to the realm of our consciousness. The origin of the term comes from a Greek noun that means the revelation of the mind. These substances can be illegally used for recreational purposes, which is, by the way, a practice I highly don't recommend. Nevertheless, there is rising medical literature around them for medical use in many diseases. Some examples include severe and resistant depression, severe PTSD, addictions, anxiety, and fibromyalgia. What are the different types of psychedelics? Most psychedelics can be included in one of the following 9 groups of compounds. We have magic mushrooms containing the active compound psilocybin or psilocin, the LSD family, a compound derived from extract of rye ergot, ayahuasca, and hermelin, traditionally consumed by shamans of the tribes of the Amazon, nutmeg, and MDA. Nutmeg has an empathic effect and creates mild hallucinations. MDA and MDMA are synthetic psychoactive substances belonging to the class of amphetamines. Although these two substances share a similar chemical structure, they have slightly different effects. MDA is known for its stronger hallucinogenic properties and stimulating effects, while MDMA is recognized for its more pronounced sympathogenic and euphoric experiences. DMT and other short-duration tryptamines act on serotonin receptors in the central nervous system. They induce the most visually impressive hallucinations. Marijuana and hashish have a synergistic effect with all the others. Tetrahydrocannabidiol, or THC, is the most commonly known molecule in cannabis. Iboga and ibogaine produces vivid hallucinations. Fly agaric, panther, amanita, and soma. Following a special preparation, ingestion was believed to induce states of consciousness that enabled communications with the spirit world. Peyote, mescaline, and San Pedro are types of cacti known for containing various alkaloids, such as mescaline. They are consumed for their psychoactive and hallucinogenic effects. What psychedelics are in clinical trials for the purpose of medical therapeutic use? This category includes molecules that target a specific receptor called serotonin 2A receptor, such as LSD, DMT, and psilocybin. Other molecules such as MDMA, a molecule that is chemically related to amphetamine, is considered a psychedelic-like substance. The reason behind this difference in nomenclature is the difference in the mechanism of action between MDMA and the other classic psychedelics. Indeed, in addition to its high affinity to serotonin transporters, it has also a high affinity to the dopamine and norepinephrine transporters, It acts by blocking these transporter proteins, making the three neurotransmitters more available in the synaptic cleft. Where's the difference between psychedelics and SSRIs in terms of their mechanism of action? For those who never heard about this nomenclature, SSRIs, it refers to selective serotonin reuptake inhibitor, or the commonly known antidepressant molecules such as escitalopram, paroxetine, and fluoxetine. Well, these molecules act by inhibiting the reuptake of serotonin, which leaves more of it available in the synaptic cleft for further use by the brain. In other words, the difference between the two remains on the direct activation of serotonin receptors by psychedelics and an indirect action of the SSRIs by raising the availability of serotonin in the brain. Where's the reported objective brain effect of psychedelics? What have been noticed in functional brain MRIs that were performed in subjects under psychedelics is that there is an enhanced global functional brain communication and connectivity between the different brain areas, alongside with a shutting down of the default mode network. This network is normally on when we are not involved in a task. We can label it the resting state of the brain or the wandering mind, allowing us to be in an introspective state, thus have an inward focus. At the opposite, when we are involved in a task, the activity of the default mode network is reduced, allowing us to have goal-oriented actions and an outward shift of focus. The hypothesized structure of the brain responsible for this greater and wider brain communication is called the colostrum. When did the medical psychedelic use started? The use of psilocybin, the active compound in magic mushrooms, alongside psychotherapy for psychiatric disorders can be tracked back to the 1950s. However, in the 1970s, the societal and political climate led to the classification of psilocybin and other psychedelics as Schedule I substances, which significantly delayed research on their therapeutic potential for nearly 3 decades. In recent years, there has been renewed interest and a resurgence in research on the use of psychedelics for treating psychiatric disorders. What are the different effects one might experience after taking these substances? As some of you might know, they tend to induce what is commonly called bad trips or breakthroughs, a kind of sword with two edges, right? Some people also describe 5 to 7 levels of depths in the experience, depending on the dosage taken and the psychological profile of the person. In the clinical trials conducted for the use of these psychedelics as medicines, the usual and common effects described during casual usage have been similarly noted, with some slight differences in effect between these three psychedelics. Psilocybin and LSD tend to cause initial anxiety and negative emotions, then mood swings, hallucinations, mostly visual, and ego dissolution, an afterglow and integration of the experience afterwards. LSD takers tend to display more intense hallucinatory signs and deeper ego dissolution feeling. These effects last around 4 to 6 hours. DMT used in ayahuasca ceremonies is less potent, but use in high dosing might have a big and quick effect within minutes, which is labeled as rocket trips. It can induce the same symptoms as other psychedelics, but especially an enhanced sense of connectivity with others in the world, with an emphasis on its short effect duration that lasts around 15 to 30 minutes. I want to emphasize on the fact that all of the studies conducted on psychedelics used a specific dosage for each molecule. The mean dosage for each one of them differs throughout the studies. I will not focus on this part since this podcast is only for educational purposes and there are yet no approved doses for clinical medical use. It is still relevant to state that during clinical trials, the administration of these molecules required a controlled setting and the whole experience was monitored by healthcare professionals. The notion of dosing and monitoring are crucial, since the use of these substances don't come without side effects, especially if the former conditions aren't respected. The next question will be, is there a danger taking these substances? Well, no psychoactive substance comes without side effects, but what we know is that psychedelics are physically safe. There is no known lethal overdose amount for LSD and psilocybin. They are not addictive, and they rank at the bottom of the list amongst all the major psychoactive compounds in terms of harm to self and to others. Finally, are there conditions where taking these substances is not allowed? It is not recommended to use these substances in conditions such as schizophrenia and bipolar or psychotic disorders. What are the reported therapeutic results? That's what's most important, right? Well, here I'm sharing with you recent abstracts of one meta-analysis study in review that have been performed around the use of psychedelics in depression and a phase 3 clinical trial for the use of MDMA in severe PTSD. Just for your information, a meta-analysis study is a research method that involves analyzing the results of multiple independent studies on a specific topic and provide a robust understanding of that topic by synthesizing data from these studies. Whereas a phase 3 clinical study is a large-scale controlled research trial conducted in humans to evaluate the effectiveness, safety, and potential side effects of a new medical intervention, and it is typically the final step before seeking regulatory approval for marketing the intervention. Okay, let's get back to the results of these studies. In a nutshell, in the meta-analysis in review, a significant reduction in the depressive symptoms was reported in all conditions studied after the administration of psilocybin, ayahuasca, and LSD. This reduction was significant at day 1, at 1 week, and at week 3 and 5. Nevertheless, some limitations have been reported, primarily the absence of long-term follow-ups and the small sample size of the population in all but one study. The phase 3 clinical study concluded that compared to a placebo, MDMA-assisted therapy is highly efficacious in individuals with severe PTSD, and treatment is safe and well tolerated, even in those with comorbidities. So, what should we retain from these interesting studies? In my opinion, these are encouraging results that may consider caution in their interpretation, considering their limitations, especially the absence of a long-term assessment of the results and the small size sample of the studied populations. But still, most of these results are exciting for the medical community and will certainly help foster the conception of other randomized clinical trials around the use of psychedelics. Up until this day, the use of these drugs is only legal in clinical trials. There is, as we have seen, a phase 3 clinical trial conducted for MDMA in severe PTSD and another similar type of study for the use of psilocybin in severe depression, which means that these studies are submitted for the FDA approval and waiting for it before they can be marketed as medicines in the indications we mentioned earlier. I guess we are at the end of our hotspot episode. I hope this episode was thorough and that you were able to absorb most of the data I have shared with you. Please let me know your feedback, and if there is anything you want to clarify or explore deeper, just drop me a comment down below and I will get back to you as soon as I can. Last but not least, don't forget to push the subscribe button and hit the notification bell so that you don't miss any of the content on my channel. Till next time, see you soon.